Hi, welcome to the fifth talk on healthcare communication skill series. Today, in this talk, we are going to discuss the communication between the healthcare staff like physicians, nurses. Up till now, we have discovered the how to talk with the patients, their relatives, attendants in time of emergency, in the time of breaking the bad news or talking to towards when we are doing the follow up in the OPD or in the inpatients or while doing the rounds. But now we will talk briefly about how we interact with each other in the unit as a team so that it will benefit the management of the patient as a coherent unit. Errors are about to happen when there is no good communication between the team members. So errors happen often not from the lack of the skill or from the lack of the work, but because of the lack of communication. Most of the errors in the healthcare sector occurs because of lack of communication. I can tell you the data, it is about more than 60 to 70%. And these errors can lead to devastating situations and jeopardize the management strategy and quality of management. So, when we have less communication with our colleagues, our staff, then it is most likely that we will end up with the incoherent strategy for management of the patient. So, interacting with our colleagues is very important, and the communication is the key step towards good management of the patient. So we know that because we are working in the environment of a team, so we have the same shared goals. We all want to make the life of the patient comfortable through our management and do the improvement of the disease process towards the uh, betterment of the until the patient improves and their disease end up with good health. So we should have a clear goal of treating the patient in a team manner. Coordination should not only with the colleagues, the coordination is with the other units also. The coordination should be with the physicians, nurses, other healthcare staff across the shifts also. And we have to make a safety culture and mutual respect among the team members. And communication is the key part of this mutual respect environment. So, when we say communication, so healthcare delivery is a teamwork, and communication is the glue of the healthcare teamwork. So, if we don't have this glue, the team is there, but because of the lack of communication, it is not possible to give the best of the treatment to the patient. While we are working in the hospital environment, we have our communication set of tools. We are communicating with progress notes uh, in the electronic health records. We have S-bar handover, daily safety hurdles we come across, and briefing and debriefing. And with this, we make structured communication which prevents the loss of the critical information during the management of the patient. And it helps the patient and the physicians both towards the same goal for management of the patient's ailment. While we are communicating with our colleagues, we should make sure that our message is delivered correctly and to the proper through the proper channel so that this uh, message or this order or this communication is implemented or not. So, to prevent any misunderstanding, we have to repeat our message so that we should make sure that it is understood according to the knowledge of the environment. So, especially vital, it is very vital during the time of emergencies or critical situation because mistakes occur because of the misunderstanding. But because there are hierarchies and there is a level of level of administration or so the person or the physician or the nurse is very much fearful because and during this uh, it is not possible to communicate it clearly, and sometimes there are personality clashes. There are internal disagreements between the colleagues, and also there is a lot of workload in the time of emergencies, and the patient person is fatigued. So it is sometimes very difficult to communicate clearly, and so foster openness and respect across the ranks. So please, when you communicate, communicate very clearly without looking at the emotional aspect of your relationship with your colleague. The key points for this is the psychological safety that we work when we work in the team and when we observe that there is some clinical pathway is not observed, we have to speak up for safety. We have to listen to our colleague, even if this is our fault. We should appreciate the contribution of the people who are speaking up. We can ask them in detail what has been occurring and what has been the deviation from the clinical pathway, and we will try to correct it even if we are involved in this deviation. So psychological safety makes the team very stronger, and it makes it easy for the physician to treat their patient with safety. So the take home message is that the clear and respectful communication leads to the safe care, leads to the good management of the patient, leads to the better outcome for the treatment of the patient. And team success depends on trust and clarity. So this finishes our talk for communication between the colleagues. I hope you have enjoyed this talk. Thank you.